Every night, millions of Americans go to sleep without realizing they're putting their heart under silent but deadly pressure. It's not about what you eat. It's not about your medication. It is about what you do or don't do in the final 60 minutes before you close your eyes. Have you ever thought that just the last 60 minutes before you close your eyes could be that important? And for people over 60, this habit could be the trigger that pushes a vulnerable heart over the edge. Recent studies from cardiovascular sleep labs across the US have confirmed something alarming. Poor sleep routines don't just lead to fatigue. They're directly connected to increased nighttime blood pressure surges, irregular heart rhythms, and in some cases, the early signs of heart failure. The culprit? A handful of common bedtime habits that most people never question. One of the most dangerous is watching television or scrolling on your phone just before bed. It seems harmless, but the blue light emitted by screens doesn't only interfere with melatonin. It stimulates cortisol, your body's stress hormone. This effect is amplified in older adults. What follows is a spike in blood pressure that continues even after the lights go off. Your brain believes it's still daytime. Your heart doesn't rest, and while you're lying still, your cardiovascular system is still in fight or flight mode. Are you scrolling on your phone or watching TV right before bed? But that's just the beginning. Another mistake rarely talked about is going to bed shortly after eating. When you lie down with a full stomach, the digestive process intensifies, requiring increased blood flow to the stomach. This diverts resources from the heart and can trigger nighttime palpitations, especially in people with pre-existing conditions. More troubling is the link between late dinners and nighttime blood pressure elevation. A study published in the Journal of Clinical Hypertension revealed that individuals over 60 who eat less than 2 hours before sleeping have a 2.5 times higher risk of nocturnal hypertension. Have you ever felt heavy or had heart palpitations when lying down after eating late? Now, think about posture, something as simple as the way you sleep. Many seniors naturally prefer sleeping on their right side, believing it to be more comfortable. But for those with congestive heart issues or atrial fibrillation, this can actually worsen symptoms. Lying on the right side may compress the vena and create subtle shifts in heart position, making it harder for the heart to maintain stable rhythms. While this might not affect younger people, aging hearts become more sensitive to even minor anatomical changes during rest. And what's your favorite sleeping position? Then there's a hidden mistake that's almost universal: not emptying the bladder before bed. It sounds trivial, but this one decision can fragment your sleep, lead to abrupt nighttime awakenings, and cause sudden spikes in blood pressure. When you rise quickly from deep sleep to rush to the bathroom, your body undergoes a sudden shift in posture and adrenaline. In older adults, especially those with weak vascular tone, this can result in dangerous fluctuations in heart rate and pressure. Some cardiologists now consider this one of the hidden stressors for the elderly heart. Do you often have to wake up in the middle of the night to use the bathroom? Even the height of your pillow may play a role. Too low and your airways narrow, forcing your heart to work harder for oxygen. Too high and it can alter the angle of your neck and upper spine, disrupting circulation to the brain and triggering nighttime arrhythmias. Proper head elevation is not a luxury. It's a form of cardiovascular hygiene that is largely overlooked. And here's a shocking detail few doctors mention: your sleeping position affects lymphatic drainage. Lying flat on your back, especially after a salty dinner, can lead to fluid retention that subtly increases cardiac preload, the amount of blood the heart has to pump out. For those with borderline heart function, this can tip the balance toward overload. You wake up tired, heavy, and anxious, not realizing your heart spent the night under siege. Have you ever woken up feeling tired and heavy, even after enough sleep? The real danger is that none of these symptoms feel dramatic at first. They creep in slowly, a little more fatigue in the morning, a small spike in blood pressure at your next checkup, a night of light chest discomfort you blame on indigestion. But over weeks and months, these invisible mistakes compound. Are these small signs familiar to you? And by the time you notice something's wrong, your heart may have already changed its rhythm, structure, or resilience. Yet, all of this can be reversed, not with drugs, but with timing, posture, light, and awareness. Simple tweaks in your nightly routine can dramatically ease the load on your heart, stabilize your pressure, and allow your cardiovascular system to truly rest during sleep, just as it was designed to do. The body is not designed to fight for survival while it sleeps. But for many people over 60, that's exactly what's happening every night. Do you think your heart is truly resting every night? Fortunately, there are specific adjustments you can make before and during sleep that naturally support heart function and reduce hidden cardiovascular stress without medication. So, how can we make these simple changes without medication? First, one of the most powerful actions is to set a fixed cool-down window before bed. This means creating a consistent 60-minute routine where all high-stimulation activities are stopped. No phone, no bright screens, no heavy discussions. Instead, use this time to dim the lights, reduce movement, and shift into calm breathing patterns. Research from Harvard's Division of Sleep Medicine shows that a consistent pre-sleep wind down significantly lowers resting heart rate and improves parasympathetic activity, the system responsible for rest and repair. Are you ready to dedicate the last 60 minutes of your day to your heart? The next key adjustment is meal timing. Try to finish your last meal at least 3 hours before sleep, especially if it includes salt, fat, or protein. These nutrients require more intense digestion, pulling blood flow away from other organs and forcing the heart to compensate. A light early dinner with easily digestible foods such as cooked vegetables, whole grains, or soups allows the body to fully process nutrients before sleep, giving the heart less work to manage overnight. Another silent but effective tool is gentle hydration balance. Many seniors either drink too little and wake up dehydrated, or drink too much and interrupt their sleep with bathroom trips. The solution? Focus on hydrating steadily throughout the day. And in the last 2 hours before bed, sip only small amounts of water if needed. Proper hydration supports blood volume, reduces clot risk, and helps the kidneys regulate fluid without overloading the heart. Next, we address sleeping position. While sleeping on your back may seem like a neutral choice, it often promotes snoring, airway obstruction, and fluid redistribution that can tax the heart. On the other hand, the left side has been shown to optimize circulation, reduce pressure on the heart, and support better drainage of excess fluids. In fact, A study published in the American Journal of Cardiology found that heart patients experienced fewer nighttime arrhythmias and more stable heart rates when sleeping on their left side compared to the right. For individuals with orthopedics issues or back pain, this might require pillow support under the knees or between the legs to maintain spinal alignment while still allowing left side positioning. It's a small shift with profound physiological impact, especially for older adults. Can you try changing your sleeping position to your left side? Bedroom temperature also plays a role. A cooler environment, ideally between 60 and 68 F1520C, encourages vasodilation, or the widening of blood vessels. This lowers internal pressure and allows the heart to maintain stable rhythms. High room temperatures, on the other hand, can lead to increased heart rate, sweating, and shallow sleep, all of which place additional burden on the cardiovascular system. What's the temperature of your bedroom? Another overlooked strategy is the use of breath control techniques just before sleep. Simple, slow, diaphragmatic breathing around 5 to 6 breaths per minute stimulates the vagus nerve. This single habit activates the body's rest and digest state, slows heart rate, and balances blood pressure. It's been shown in several peer-reviewed trials to reduce nighttime palpitations and improve sleep depth, especially in adults over 60 with mild hypertension. Is a few minutes of deep breathing difficult for you? For those who suffer from occasional anxiety or overthinking before bed, a major trigger for nighttime blood pressure spikes, consider adding low-intensity stretches or gentle floor-based yoga. This isn't about burning calories. It's about creating a ritual that tells your body it's safe to let go. The effect on heart rhythm is measurable. Less variability, more coherence, and better nighttime blood pressure regulation. Finally, the lighting you use at night matters more than most people realize. Swap overhead LEDs and screens for warm amber light, ideally from a small bedside lamp. Exposure to blue-white light suppresses melatonin and elevates alertness, while amber tones signal the brain to begin slowing down. This directly influences how quickly your blood pressure drops after lying down, a key process in cardiovascular recovery. Is the light in your bedroom too bright or too blue in the evening? Each of these adjustments may seem minor, but together they create a powerful shift in how your heart experiences the night. Instead of battling stimulation, poor digestion, heat, or stress, your heart can enter true recovery mode. And when that happens consistently, the benefits compound. Lower pressure, deeper sleep, fewer palpitations, and a stronger, calmer cardiovascular rhythm over time. Night is supposed to be a time of restoration. But for many people over 60, the heart is not recovering. It's struggling. And the most disturbing part is that most of the warning signs show up not during the night, but in the first 15 minutes after waking up. Cardiologists refer to this as the cardiac transition zone. It's the delicate period when your body shifts from sleep mode into alertness. And it's when the majority of silent heart attacks, arrhythmic episodes, and blood pressure spikes occur, often without symptoms strong enough to raise immediate alarm. How does your morning begin? Do you notice any unusual signals your body is sending? That's why understanding these subtle morning clues can be life-saving. The first and most common warning is unexpected fatigue upon waking. It's easy to blame poor sleep or age itself. But if your heart spent the night under pressure, fighting through high blood pressure surges, low oxygen levels, or poor circulation, your cells didn't regenerate properly. That results in a type of tiredness that lingers well past breakfast. This isn't simple sleepiness. It's cardiovascular exhaustion, and if it occurs regularly, it's not normal. Do you often feel tired even after getting enough sleep? Another key indicator is morning dizziness or lightheadedness when getting out of bed. This can signal orthostatic hypotension, a sudden drop in blood pressure caused by a delayed cardiovascular response. It's a red flag, especially in seniors. The aging heart sometimes struggles to pump enough blood to the brain during sudden posture changes. But here is the hidden danger. These drops are often preceded by a night of heart rate instability or mild oxygen dips that go unnoticed. Do you get dizzy or lightheaded when getting out of bed suddenly in the morning? If you experience frequent headaches in the morning, especially those that feel like a pressure or heaviness around the temples or base of the skull, that could point to nocturnal hypertension, a condition where blood pressure fails to dip at night or worse, rises. This condition silently damages arteries while you sleep. Over time, it contributes to left ventricular hypertrophy, a thickening of the heart's walls that increases the risk of heart failure and stroke. Are morning headaches a familiar friend for you? Look also for swelling in the feet, ankles, or fingers when you wake up. Overnight fluid retention, especially in the lower extremities, can indicate poor venous return and reduced cardiac output. If your heart isn't pumping efficiently, fluid accumulates in the tissues and gravity pulls it downward. This early morning puffiness often fades during the day, which is why it's dismissed. But consistent swelling after sleep deserves attention. Have you noticed slight swelling in your feet, ankles, or fingers in the morning, even if it's just for a short time? Pay close attention to your breathing. Waking up short of breath or needing to sit up suddenly to breathe deeply could indicate paroxysmal nocturnal dyspnea, a sign that fluid may be backing up into the lungs due to reduced heart efficiency. It doesn't always happen violently. Sometimes it's a gentle creeping discomfort that builds over time. But if you ever wake gasping, coughing, or with a tight chest, especially while lying flat, it's time to investigate your heart health. Have you ever woken up suddenly feeling short of breath or having trouble breathing, especially when lying flat? Even the rate of your heartbeat in the morning carries vital clues. Ideally, your pulse should be steady and calm after waking. But if you notice a pounding heart, irregular rhythm, or rapid pulse, particularly if you didn't have a stressful dream or anxious thoughts, this may reflect nocturnal arrhythmias. Atrial fibrillation episodes, for example, often begin during sleep and remain undetected until you stand up and feel your chest flutter or race. When you wake up, does your heart beat strongly, irregularly, or too fast? And what about nocturia, the need to urinate several times a night? While often blamed on the bladder or prostate, frequent urination at night can be a subtle sign of heart failure. As the heart struggles to pump efficiently, fluid accumulates in the lower body during the day. When lying down, this fluid returns to the bloodstream and is processed by the kidneys, leading to nighttime urination. It's a compensation mechanism and a signal that something deeper is out of balance. Do you have to wake up to urinate multiple times during the night? Some people also wake up with a dry cough or sore throat, especially if they have been snoring. But beyond simple snoring, these can point to airway restriction and drops in nighttime oxygen levels. This condition, known as sleep apnea, places enormous stress on the heart. Every time oxygen falls below normal, the body triggers a stress response, releasing adrenaline, tightening blood vessels, and increasing heart rate. Repeated dozens of times per night, this invisible strain accumulates silently. Are you or your partner a loud snorer, or do you show signs of sleep apnea? Fortunately, morning is also the best time to intervene. The first 30 minutes after waking are critical for resetting your cardiovascular system and clearing any residual stress from the night. Are you ready to discover these simple strategies? There are simple non-medical strategies you can implement right now to protect your heart from further damage and give it the reset it needs each morning. Start by resisting the urge to jump out of bed too quickly. Instead, take 30 to 60 seconds to sit upright slowly, breathing deeply, letting your circulation stabilize. This one action reduces the shock to your heart and helps avoid sudden pressure drops that can lead to dizziness or even fainting in vulnerable individuals. Are you in the habit of jumping straight out of bed immediately? Before you even brush your teeth, consider doing a brief round of gentle ankle and wrist rotations. These movements stimulate circulation through the extremities and send a wake-up signal to your vascular system. For seniors, this also lowers the risk of early morning clots, a known danger in sedentary sleepers or those with peripheral artery disease. Next, give your hydration a strategic boost. Drinking a full glass of room temperature water within the first 15 minutes of waking helps thin the blood, reduce morning viscosity, and support kidney function. It also counteracts the natural dehydration that occurs overnight, a major contributor to early morning blood pressure spikes and cardiac strain. Do you regularly drink water right after waking up? Temperature plays a role too. A quick facial rinse with cold water or a splash behind the neck activates the vagus nerve. This simple habit can immediately lower your resting heart rate and calm your nervous system. It is one of the oldest tricks used in emergency medicine for regulating a regular heartbeat, and you can do it at home every morning for free. Have you ever tried this simple emergency medicine trick at home? Many seniors overlook the importance of breathing awareness. Upon waking, practice 2 minutes of slow nose-based breathing. Inhale for 4 seconds, hold for 2, and exhale for 6. This technique not only resets your stress response, but has been shown in studies to improve morning heart rate variability, a critical indicator of cardiac health and longevity. Do you spend a few minutes